Everybody, Mike Brown, excited to be here with Bob Waddell. He's going to tell you a little bit about himself and about what he's going to be speaking on at FDIC International in April 2026. Bob.
Thanks, Mike. I appreciate the opportunity. So, as Mike said, I'm Bob Waddell. I'm the training manager for SAM Medical. Is my day job, involved in a lot of things. My background is I've been in EMS for 50 years now. Started as a EMT basic in rural Wyoming. Actually, I'm quite proud. I was the youngest EMT ever certified in the state, and practiced in Wyoming for a bit. Then went on to Colorado, became a paramedic, and moved on from there. I've worked the streets for 26 years, a couple decades, and then I've been in administration and education in the U.S., both local, state, national level, and then have when I had my training company, we had projects on 3 other continents besides the North American continent. So have done a lot of work around the world, various aspects of patient care, EMS system development, and so. But now I'm with Sam, and very excited with some of the new changes that are going to be at GIM/FDIC. The lecture I'll be giving is on the lies we teach, pediatric myths, and part of it with my background, I was the National EMS Systems Director for the Emergency Medical Services for Children's program for a handful of years, and so pediatrics is near and dear to my heart. But one of the big challenges comes down is what is a pediatric, and so as the kind of the intro to this class, it's if you follow American Heart, any kid that has had their 8th birthday gets adult resuscitation efforts and adult CPR, and yet, that we know that's not true. We don't let 8-year-olds or 9-year-olds or 10-year-olds drive. We don't let them drink. We don't let them vote. So why would we let them do adult treatments on them? The other aspect of that is the adolescents, and adolescents are really the forgotten age group. We don't know what to do with those kids that may physically be the size of an adult, but are they emotionally and intellectually the size of an adult, or vice versa? That child that is intellectually and emotionally an adult, but they're in this little body, So go through some of those things, and we talk about some of the ones. One of the biggest ones, for this. Let's look at the Waddell's triad, which I did not. That's not my triad. Wished it was. I'd really like to meet Dr. Waddell, who is a Canadian physician. But if you look at his study, one, it's very small. He had less than a dozen patients in the study that he looked at, and the youngest one was 21. The oldest one was in their 70s. There were no pediatric, almost by any criteria. And the American College of Surgeons and some others took that and twisted it, and then when he came out with it in the 70s, it wasn't even, we didn't have the social media like we have now, but this thing still went viral, and it got twisted and contorted to Waddell's triad, the 3 injuries of a child being hit by a car. So this lecture, we look at those things, we take some of these carved in stone, we get tested on them, concepts that have been false for decades, some of them for a lot longer than that, a century, and try to bring those out. And it's not to say change your protocols, stop doing this or stop doing that, but it's start thinking critically. You need to, whether you're new in the field or you're multi-decade experienced person, you're like Mike, an officer within your department, take that to the other folks, take that to medical control, your medical director, and say, is our protocol correct? Are we actually treating patients correctly? And not just these dozen type things that are in the lecture that I'm giving, but let's look at our protocols. Why do we grab these weird, medically inappropriate things, institutionalize them, make them protocol, make them gospel, um, and yet it has nothing to do with patient care. So that's the big focus. And then the other kind of theme throughout is, you look at resuscitation, and it's what is a successful resuscitation for EMS. Often it's if we can get them inside the emergency department with some sign of life. And then, tongue in cheek, it's not our fault the nurses and the doctors let them die. Yet you look at Europe and the Nordic countries for decades, their definition of successful resuscitation is the patient has ROSC for 2 weeks after the event. And so, we start looking at those things, and it may not just be life and death, but it's also how many hours or days or weeks or months did we reduce the patient's hospital care? That's a successful resuscitation. I'm treating my patient, I'm letting them, helping them, help facilitating them going back to their normal life in a shorter time frame if I'm part of the medical team versus I'm just the renegade paramedic, and you know what? I throw them into the emergency department, and whatever happens, happens. So we talk a lot about that. It's a little bit of half lecture and then a lot of discussion, patient case reviews. We don't violate any HIPAA or patient privacies, but we've all had those patients that it's like, maybe I should have thought more critically about this, and that's the real focus, is getting providers to think more critically, beginning to end.
I love it, and I'm excited for the class. And that's a great way to sum it all up, because that's what GEMS and FDIC is all about, is promoting critical thinking skills and sharpening that edge. So I'm excited to see everybody there. I'm excited to have you there in April in 2026. So thanks for your time today, Bob. I really appreciate it.
Thank you, Mike. I'm excited to be there, and again, for those that I know Mike has a very strong following. Share your information, share your knowledge. Don't keep it encapsulated. So, Mike, I appreciate what you guys are doing, what GEMS FDIC is doing. Thank you very much.